This video is on failure to thrive. Failure to thrive is a term used in the pediatric population to describe significantly slow weight gain. So note this is not necessarily weight loss, just a reduction in the rate of weight gain. There are a variety of causes of failure to thrive, which we'll look through one by one. So the first main heading is inadequate intake. So the kid may not be eating enough and hence not putting on enough weight. Inadequate intake could be due to a variety of reasons. Firstly, it could be due to inadequate nutrition, inadequate drinking. So this could be due to not frequently enough having breastfeeds or having inappropriate formula. Or the frequency of the breastfeeding could be fine, but there could be some abnormality in the baby that causes them to ineffectively have the milk, and this could be due to cleft palate or tongue tie. There could also be persistent vomiting and anorexia of chronic disease. Another reason is the baby may be having enough intake, but once taken in, it cannot be adequately absorbed. So this could be due to intolerance, such as in celiac disease, which is gluten intolerance, or cow's milk allergy. There may be pancreatic insufficiency, where there are reduced enzymes which help digest food, so things like lipase that digest fat, for example. There could also be due to cystic fibrosis, where the viscous fluids block the pancreatic ducts so the enzymes are not released. There may also be chronic liver disease. So intake and absorption could be fine for a normal person, but another person may require higher metabolic demands because they're having excessive caloric use. And this could be due to hyperthyroidism or congenital heart disease. Congenital heart disease can be acyanotic or cyanotic and generally picked up on an echocardiogram or ECG. And there are specific investigations for each abnormality. Hyperthyroidism, they may have changes in temperature, may be sweaty, and also have eye signs as well in the case of Graves' disease. The final heading is the most serious heading because it has red flags and is not necessarily due to a physiological abnormality. And this could be due to abuse or neglect, which is very sad, and it can be related to inadequate intake where the parents deliberately do not feed the baby enough. However, there may be other reasons for the baby not being fed enough. It may not be deliberate. There may be financial situations, they're in poverty or parental depression. There are important complications to consider, such as short stature, secondary immunodeficiency, which would predispose them to opportunistic infections, as well as permanent central nervous system damage. Investigations are not usually indicated if otherwise the baby is healthy, and investigations would seek to address the underlying cause. But it is also important to track the height and weight growth of the baby as shown in this diagram, and this is how you diagnose failure to thrive. If there is dropping of placenta lines in weight, that suggests that the patient is not tracking and putting on weight appropriately, putting on weight as most people do, and that's why it's called significantly slow weight gain and hence failure to thrive if they're dropping placenta lines. So for example, if they're normally on the 50th percentile, but then for some reason they drop to under the 5th percentile, such as in this case, that would be concerning. Management seeks to address the underlying cause, but it is also important to provide supportive measures such as reassurance if the baby is otherwise well, and consider education as a diet if they need to be eating more, if they need to change formulas. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.